Reports of a significant increase in rodent populations across New York City have triggered renewed focus on the potential for zoonotic disease transmission, specifically involving hantavirus. While the city has long grappled with its rat population, the current scale of the surge is being characterized by some observers as a critical public health juncture. Hantavirus represents a group of viruses primarily spread by rodents, and in the Western Hemisphere, it is most commonly associated with hantavirus pulmonary syndrome, a severe and sometimes fatal respiratory disease. In an urban environment like New York, the intersection of dense human habitation and high rodent activity creates a unique set of challenges for municipal health departments and surveillance teams. Understanding the risks requires a look at how these viruses move from animal reservoirs to humans. Hantaviruses are not spread through casual person-to-person contact in the way we see with seasonal influenza or other respiratory pathogens. Instead, the primary route of infection is through the inhalation of aerosols. When rodent urine, droppings, or nesting materials are disturbed, the virus can become airborne. Individuals who breathe in these contaminated particles are at risk of developing the illness. While the headline suggests a pandemic threat, it is important to distinguish between a localized outbreak or an increase in cases and a global pandemic. Hantavirus lacks the efficient human-to-human transmission required for a traditional pandemic, yet for the individuals affected, the clinical outcomes are often grave. Public health officials monitor these situations closely because an explosion in the rodent population directly increases the statistical likelihood of human virus encounters. The virus itself is hardy, capable of surviving for several days in the environment under the right conditions, though it is easily neutralized by household disinfectants. As we examine the situation in New York, the focus remains on the biological data. How many rodents are carrying the virus? Where are the highest concentrations of activity? And what is the current capacity of the local health infrastructure to detect early human cases? This reporting seeks to separate the urgent reality of rodent-borne illness from the sensationalism of the current headlines, providing a clear-eyed look at the surveillance efforts currently underway to protect the public in one of the world's most populous cities. The core of any public health response to a viral threat lies in the labs and the agencies tasked with monitoring environmental indicators. In the wake of reports concerning a rodent boom, municipal health agencies are expected to ramp up their surveillance of the rodent population to determine the prevalence of hantavirus strains. This involves the systematic trapping and testing of rats and mice across various districts to map out hot zones where the viral load in the animal population may be highest. In New York City, the Department of Health and Mental Hygiene typically coordinates these efforts, often in conjunction with the Centers for Disease Control and Prevention. Lab testing for hantavirus involves sophisticated molecular techniques. Researchers utilize polymerase chain reaction, or PCR, to detect the presence of hantavirus RNA in tissue samples, as well as enzyme-linked immunosorbent assays, known as ELISA, to identify antibodies that indicate previous exposure. These results are critical for determining whether the current rodent surge represents a heightened viral risk, or if the virus remains at baseline levels within the population. It is also important to note the specific strains involved. While many are familiar with the sin nombre virus found in the American Southwest, urban centers often deal with the Sol virus, which is carried by Norway rats and can cause hemorrhagic fever with Raynaud syndrome. Medical facilities and clinics in the affected areas are often placed on high alert during these periods, with clinicians advised to look for early symptoms that might mimic the flu, such as fever, muscle aches, and fatigue, but which can rapidly progress to more severe respiratory or renal distress. Public health reporting also looks at the logistical side of the crisis, such as waste management and housing conditions, which serve as the primary drivers for rodent proliferation. When officials speak of rat wars or unleashed viruses, the underlying reality is often a struggle with aging infrastructure and the challenges of sanitation in a city that produces thousands of tons of waste daily. Verified data from hospital admissions and diagnostic labs remains the gold standard for tracking the situation. While claims of an impending pandemic may circulate, epidemiologists look for confirmed case counts and evidence of shifting transmission patterns. At this stage, the focus is on containment and the rigorous testing of both environmental samples and symptomatic individuals to ensure that any spike in activity is met with an immediate and effective clinical response. Prevention and public guidance serve as the primary line of defense against hantavirus, particularly when rodent populations are high. Public health authorities emphasize that the most effective way to avoid infection is to eliminate rodent habitats in and around human dwellings. This involves sealing even the smallest gaps in walls and foundations, as mice can enter through openings as small as a nickel. Guidance issued to residents typically focuses on the safe cleaning of areas where rodents may have been present. It is a critical point of safety that individuals should never sweep or vacuum rodent droppings, as this action kicks the virus into the air where it can be inhaled. Instead, the standard protocol involves thoroughly wetting the area with a disinfectant or a mixture of bleach and water before wiping it up with paper towels. This method keeps the viral particles trapped in liquid and neutralizes them on contact. For those working in logistics, shipping, or construction, where exposure to long untouched spaces is common, the use of personal protective equipment, including gloves and high-efficiency particulate air masks, is often recommended. Beyond individual actions, the limits of current knowledge must be acknowledged. While we understand the mechanics of transmission, predicting the exact timing of an outbreak remains difficult, as it depends on a complex web of climate factors, food availability for rodents, and human behavior. Public health surveillance is an ongoing process of data collection and adjustment. We know that early detection saves lives, yet the initial symptoms of hantavirus are often nonspecific, leading to potential delays in diagnosis. As the situation in New York and other urban centers continues to evolve, the emphasis remains on vigilance and the scientific monitoring of the rodent-human interface. Maintaining a calm, informed approach is essential for navigating these public health challenges without succumbing to unnecessary alarm. By following established protocols for rodent control and environmental hygiene, the risk to the general public can be significantly mitigated. For more updates on public health developments and global virus surveillance, consider subscribing to this channel. The core developments in any urban public health crisis involving zoonotic pathogens center on the coordination between municipal agencies and specialized diagnostic laboratories. In the context of New York City's reported rodent surge, the primary agency responsible for oversight is the Department of Health and Mental Hygiene, which manages the city's integrated pest management and disease surveillance programs. When reports surface of an unleashed virus, the first step in a verified institutional response is the deployment of environmental health technicians to conduct what is known as rat indexing. This involves a block-by-block inspection of neighborhoods to identify active signs of infestation, such as burrows, fresh droppings, and gnaw marks. Simultaneously, biosurveillance teams may be tasked with trapping specimens to determine the viral prevalence within the local rodent population. This is a critical distinction in public health reporting. A boom in the number of rats does not automatically equate to an equal boom in viral circulation, but it does significantly increase the frequency of human-rodent intersections. Laboratory analysis serves as the ultimate arbiter of the actual risk level. Technicians utilize reverse transcription polymerase chain reaction, or RT-PCR, to look for specific genetic sequences of hantaviruses in rodent tissue or human serum. Because hantavirus is a diverse family of viruses, labs must distinguish between strains like the sin nombre virus, typically carried by deer mice in rural areas, and the sole virus, which is the primary hantavirus concern in dense urban environments populated by the Norway rat. The clinical angle of these developments focuses on hospital readiness and the diagnostic pipeline. Medical centers across the 5 boroughs are generally advised to maintain a high index of suspicion when patients present with severe respiratory or renal symptoms following reported exposure to rodent-infested environments. In the laboratory, serological testing is employed to detect IgM and IgG antibodies, which indicate whether an individual is currently fighting a hantavirus infection or has been exposed in the past. These tests are complex and often require confirmation by state laboratories or the Centers for Disease Control and Prevention. While the source material suggests a pandemic edge, public health experts emphasize the need to contrast such claims with established epidemiological data. For a virus to reach pandemic status, it must demonstrate efficient and sustained human-to-human transmission. Hantavirus, however, remains primarily a spillover infection. while rare instances of person-to-person spread have been documented with the Andes virus strain in South America. There is currently no verified data suggesting that the strains found in North American urban centers have mutated to allow for such transmission. The core development being monitored by agencies is therefore not a global spread between humans, but a localized spike in spillover events driven by environmental factors. Furthermore, the logistical and infrastructure developments related to this rodent surge involve the city's waste management and housing enforcement agencies. High-density housing and aging sewage systems provide ideal harborage for rodents, and any breakdown in sanitation services can lead to a rapid increase in the population. Official statements from city planners often highlight that the war on rodents is as much a matter of civil engineering as it is of medicine. When reports indicate that the city is teetering on a crisis, it often refers to the strain placed on these municipal systems. From a lab perspective, researchers are also looking at the environmental stability of the virus. Hantaviruses are enveloped viruses, meaning they are surrounded by a lipid membrane that is relatively fragile. Outside of a host, the virus's viability is heavily dependent on temperature and humidity. It can remain infectious in rodent excreta for several days, but it is quickly deactivated by sunlight and standard detergents. This biological reality informs the official guidance provided to cleanup crews and residents. Public health reporting must therefore balance the high state language of outbreaks with the technical reality of the virus's limitations. The data currently being gathered in labs and through hospital admissions remains the only verified metric for measuring the true scale of the threat, moving beyond the sensationalism of headlines to identify whether a significant shift in the zoonotic landscape has actually occurred. The primary line of defense against the spread of hantavirus in any urban environment is the rigorous application of exclusion and sanitation protocols. Public health officials emphasize that prevention begins with structural integrity. Because rodents such as the Norway rat or the common house mouse can gain entry through openings as small as a quarter-inch or a half-inch respectively, the standard recommendation is to seal all gaps in foundations, walls, and floorboards using materials that cannot be easily breached. Steel wool, hardware cloth, and metal flashing are the preferred tools for this task, as rodents are generally unable to gnaw through them. In addition to physical barriers, the management of food sources is essential. This involves securing household trash in heavy-duty containers with these tight-fitting lids and ensuring that pet food is not left out overnight. By eliminating the environmental factors that support rodent survival, specifically food, water, and nesting sites, communities can naturally reduce the population density and, by extension, the risk of zoonotic transmission. These measures represent a shift from reactive pest control to proactive integrated pest management, which focuses on long-term prevention rather than the temporary use of chemical deterrents. For individuals who must interact with areas where rodents have been present, the safety protocols are specific and non-negotiable. The most significant risk factor for hantavirus infection is the aerosolization of viral particles. When dried rodent urine or droppings are disturbed, the virus can become airborne and enter the respiratory system. Therefore, the core takeaway for public safety is the wet method of cleaning. Experts advise against ever sweeping or vacuuming areas contaminated by rodents. Instead, the area should be thoroughly sprayed with a disinfectant or a mixture of 1 part bleach to 9 parts water. The solution must be allowed to sit for at least 5 to 10 minutes to ensure the viral envelope is completely deactivated before the material is wiped up with paper towels or rags. During this process, the use of personal protective equipment is strongly recommended, particularly rubber or vinyl gloves, and, in confined spaces, a high-efficiency particulate air mask such as an N95 respirator. These practical steps are the most effective means of breaking the chain of infection between the animal reservoir and the human host. From a surveillance and reporting perspective, it is important to acknowledge the honest limits of our current knowledge. While we understand the mechanics of how hantavirus spreads, predicting the exact trajectory of an outbreak in a dense city remains a significant challenge for epidemiologists. The virus exists in a complex ecological balance. Factors such as winter temperatures, rainfall patterns, and even changes in human foot traffic can influence rodent behavior and viral shedding. Surveillance is often reactive, relying on confirmed human cases to trigger a deeper investigation into local rodent populations. This creates a time lag between the emergence of a threat and the implementation of targeted public health interventions. Furthermore, because the early symptoms of hantavirus pulmonary syndrome, such as fever, chills, and muscle aches, are indistinguishable from more common respiratory illnesses, there is a persistent risk of misdiagnosis. Healthcare providers are encouraged to maintain high vigilance and ask patients about potential rodent exposure to ensure early intervention, which is critical given that there is currently no specific cure or vaccine for hantavirus infection. The ethical responsibility of public health reporting is to provide the public with the tools for protection without inciting unnecessary panic. While the term rat war may capture the intensity of the struggle against urban infestation, the reality is a matter of persistent environmental management and clinical awareness. The goal of municipal health departments is to manage the interface between human activity and wildlife in a way that minimizes risk while maintaining the functions of a modern city. This requires a collective effort from city-wide sanitation initiatives to individual household vigilance. By focusing on verified transmission science and evidence-based prevention, the community can navigate these biological challenges with a sense of informed calm rather than alarm. As research continues into the evolving strains of hantavirus and their prevalence in urban settings, the commitment to transparent, data-driven reporting remains the most effective tool in the public health arsenal. For further updates on global health surveillance and practical guidance on emerging viral threats, consider subscribing to this channel.